Joining you today is Hinds CC's president, Dr. Vacik, along with Ms. Hooker. She's the director of investments and initiatives with Accelerate Mississippi. And together, them two alone are making great things happening. No, I'm sure there's a great team behind both of you. But this is exciting. So welcome to you both.
Thank you very much.
Well, it's good to have you here. Okay, Dr. Vacik, I'm going to start with you because I'm guessing Hinds probably saw at least a gap that needed to be filled and sort of reach out for the partnership. So take us back to the beginning, kind of when or where did Hinds start to recognize, hey, you know what? Here's a gap that we feel like we could fill in terms of in professions here in Mississippi.
Well, that's a long story. I'll try to keep it brief.
Yes.
This is my 6th year at Hinds now. Yeah. And when I first arrived, as everybody does, I went around and looked at all our facilities, trying to see where exactly we were in all this process. And one of the things I learned was that our health sciences facility really was very antiquated. It was over 40 years old. Essentially, it was sinking, the building was. The lab space was no longer adequate to serve our needs. And so very early on, I said, I really feel like this is something, given where we are right now, that we need to invest in. And we began to look at the numbers and realize that even though we were producing a few nurses, that we could do a lot more when it came to nursing and allied health. And so at that point in time, I began to reach out. We had on our master plan, even preceding me, the idea of building a facility on the Rankin Campus. Mm-hmm. And so it just made sense. We had the location, we had the property already. And so then it just became a matter of, well, you've got to find the money. And I'll be honest with you, there were some people who did not think we'd ever find the money, told me so.
There's always those.
Yeah, there is. And it almost made me mad enough that I wanted to do it, to prove it. And so we reached out to our partners in Rankin County, initially the local government, and said, hey, we want to do this, but we're going to need quite a bit of help because this facility, about 162,000 square feet, we knew it was going to be somewhere $40 to $55 million in that range. And so we knew that we couldn't do this, obviously, as an institution. And so we reached out to our community partners, our Board of Supervisors in Rankin County. And essentially what they said is, if you can get the state to pay for half, we'll pay for half. And I thought that was a fair deal. And
Good
so
luck.
then we began working on our state legislators.
Yeah.
And again, very fortunate that we have some of our legislators who represent Hinds who also are in some leadership roles. And so that did help. I'll be the first to say that. But we reached out to them and we said, we need about $24 million. And it took us a few years, but over a couple legislative sessions, we were able to secure that money. So we went back to our supervisors and said, we need this additional part. And they said, absolutely, here's what we promised. Mm-hmm. And we went to bid with that and came in actually at a great price. And so we moved forward with that. Accelerate, of course, has stepped up as well and supported us when it's come to equipment and those things that outfit the facility. We had the money to build it, but then you've got to have the desks and you've got to have the x-ray machines and you've got to have the cameras and all those things. And so, but from there, it really has taken about 3 or 4 years, but we're coming to the final stretch. And I cannot tell you how excited I am about it. With 4 floors, the first 3 we finished, and the 4th floor we built as a shell so that we have room to grow.
Oh, that's
and
nice.
so now we're not landlocked in terms of if we want to expand by a new program, we can do that. And we know that there's so many things that continue to rise up from our local health providers that they have needs, and we want to be sure that we have the opportunity to fill those needs.
Yeah, Dr. Vacik, I'm sure when you went to our legislators, it was showing that this doesn't just benefit, Rankin County or students here. This is a way to benefit and fill gaps for the entire state. When it comes to those professions or those skilled healthcare workers that you'll be able to now help better, not only train in 2 ways, I guess, educate and train. How does that help Mississippi as sort of a whole? What gaps are those that you'll be able to help fill?
Well, obviously, just being Jackson Metro, we have the sort of the mecca, if you will, of healthcare in Mississippi. I mean, if you have a need, a big problem, typically you end up coming to Jackson for seeing a specialist or seeing someone. And as our healthcare facilities continue to expand and become more modern, that need for not just, and again, everybody always looks to nurses. That becomes sort of the default. We need nurses. Well, that's true, we do. But we don't need just registered nurses. We need practical nurses. We need nursing assistants, and then from there we need respiratory therapy assistants. We need physical therapy assistants. We have all these other areas as well that fit in together with this. And so we knew that was going to fill a gap that we had, particularly as more and more of these hospitals and clinics have moved even into sort of the Flowood part of Rankin County, and sort of between Jackson and the rest of Rankin County. And so we wanted to make sure that we were positioning ourselves so we can meet that need to serve those students. And again, we wanted to be able to expand because we were so tight with space that we really couldn't do that. And we wanted to be able to expand a number of offerings on both the evening programs and the weekend programs, which just because of logistics, where the current facility is located, wasn't real great for those time slots. And so we think we're going to have a better opportunity to get students on campus during those times.
Which, Dr. Vacik, you're like, okay, I'll make a list. So
That's
there
right.
had to be
That's right.
like a little bit of planning too, like if you're going to, start to outfit this thing. And that's what gets students excited, or people choosing Hinds to come, not just a new building, but also knowing that they're going to be getting the opportunity to learn or relearn or get their CEUs from that. So how do you stay up to date? Or who you got a team that does that?
We do. We have some really exceptional professionals within our teaching area over at the Nursing and Allied Health Center, and they began to plan it really about 3 years ago and looking at, okay, as we move into a new facility, what needs to be upgraded? Obviously the technology has continued to change. We wanted to make sure that we have the latest X-ray machine, for instance. You make sure you have the right one. But you also want to think about, okay, now if I buy this technology, am I limiting myself, or how am I smart about this, thinking about 5 years or 10 years down the road, not just this next year? And so I think we've done a really good job of trying to look at the equipment list and figure out how can we best take the resources we have, sort of spread them out as best we can, but make sure we're giving our students the top of the line that they're going to see in the medical facilities themselves. It doesn't do us any good if we bring in a student and we teach them on an equipment that's going to be something other than what they're going to see when they go to the hospitals.
No more AV rolled in.
That's right.
With the VCR. No, none of that. They've got top of the line stuff. Continuing our conversation, celebration of Hinds Community College is opening its new Health Sciences Center on the Rankin Campus this fall. We've got Hinds CC President Dr. Vacik with us, as well as Ms. Hooker. She's the Director of Investments and Initiatives with Accelerate Mississippi, who's helping make this a reality. And it's coming so close to opening day, so I know fall will be here quick like in a hurry, Dr. Vacik.
Yes, it will.
Do we already have students signed up? Are we in the process of doing that? Kind of where are we at with getting the doors ready to open?
Absolutely we are. In fact, we have already packed down the library at the current facility. We have begun packing offices down. There are some programs that we'll probably have to spend the entire summer in the old facility just because we have to teach some things out there on the equipment. But we are already gearing up. If you go to the building now, the new complex, it is probably about 85-90% done, and it is just looking incredibly sharp. I know our faculty and staff that work there are so excited to move from the old facility to the new one. It is going to be a lot of work this summer. I will tell people who are either students at Hinds or affiliated with Hinds in some way, forgive us now, because this summer I think we'll all be in jeans and T-shirts moving boxes. So to try to get them all moved from one facility to another. So
you mentioned you left the top floor, I guess the fourth floor, kind of open. Do we already have, clearly you're a visionary for Hinds, Dr. Vacik. I mean, you came in, kind of saw this and saw it through. Do you already have ideas of what's going to happen on the fourth floor, or are you really kind of allowing the students in the need to kind of fill that answer for you?
Well, I had some ideas, but I recognized that it would be a lot smarter for me to listen to our physicians and our health administrators at the hospitals and the clinics and let them try to dictate to us some things. We've done some training that we didn't anticipate earlier, like some EKG reading things we've done that we really didn't have an eye on that when we started some of this, and there'll be space for that. But I've also thought about some other programs that I think will do well in our area, but I want to make sure first that we get the pulse of where we are with our hospitals. We want our hospitals to be good partners in this as well, so we've tried to provide space where if they want to be more engaged, more involved, we want to do that with them. So we're continuing to reach out to them right now.
And it's been, what now, a 4-year journey to the opening, 4 to 5 years, Dr. Vacik?
About 4 years. I mean, well, essentially in my mind it's been about 6 because I've had it up here for quite a while, but about 4 years to get from concept to delivery. And again, that project came in at such a good price. We were so fortunate with that we also were able to tap into resources, and we're going to do some additional things in the Rankin campus as a result of that too. So I'm excited about that.
Will there be cake on opening day?
There will be cake. There will be ribbons. There'll be cake. There'll be balloons. There'll be smiles. I think folks couldn't be any more excited, not just inside our institution, but really across Rankin County.